So today we discuss general pathology of homeopathy. This is a chapter from Stuart Close philosophy. It's an extensive chapter. Lot many important concepts are discussed. So this is general pathology of homeopathy. Let's start. So human pathology is a science which treats disease condition of living human beings. There are two types of pathology as described by Dr. Stuart Close: general pathology and special pathology. General pathology bears the same relation to special pathology as philosophy bears to special sciences. It deals with principles, theories, and explanations. So, general pathology is the bearing same relation to special pathology as philosophy bears to special sciences. So what it is actually, general pathology deals with the principles, theories and explanations. So general pathology is very important in homeopathy, and what is the important concept about it is that general pathology, that is homeopathy, dealing with chronic diseases, and this is based on the theory of chronic disease and other principles. So important concept is about the chronic diseases. So chronic diseases caused by fundamental cause, that is miasms. Treatment of chronic diseases by homeopathic remedies, and all these are based on principles. So general pathology deals with the principles and how it is related, that homeopathy is strongly advocating the concept of dynamism. So let's see further. Special pathology is of two types: medical and surgical. Dr. Hahnemann's disease classification. So general pathology deals with chronic diseases. Dr. Hahnemann classified diseases into four types, that is Psora, psychosis, syphilis, occupational diseases. So here Dr. Stuart Close is giving us the explanation that Dr. Hahnemann classified diseases into three fundamental miasms, that is Psora, psychosis, syphilis, and Dr. Stuart Close adds here fourth is occupational disease. So occupational disease is due to the noxious influence of the environment, unsanitary dwellings, fumes of chemicals, lead and copper, and drug diseases. So see here, occupational diseases, they are due to the influence of environment, and here he also includes the drug diseases, that is artificial chronic diseases. And indisposition is corrected by dietetic, hygienic, moral, mechanical means. All of you know that indisposition is slight alteration in state of health, and it is corrected by diet and regimen. The third important point about indisposition is that as it is not due to the dynamic derangement of vital force, it does not require any remedies. So this is how Dr. Stuart Close is going with the Dr. Hahnemann's disease classification. That is how he explains to us about Dr. Hahnemann's disease classification. So in this chapter of general pathology of homeopathy, discussion is under four headings. First is theory of chronic disease, relation of bacteriology to homeopathy. Third is doctrine of latency. Fourth is metastasis. Fifth is the identity of Psora and tuberculosis. Next is the toxicological theory of disease, and last is idiosyncrasy and drug diseases. So that is the first one, the a theory of chronic diseases. So homeopathy has different interpretations and applications of fundamental principles of science. What does that mean? Homeopathy has different interpretations and applications of fundamental principles of science. So, fundamental principles of science are the basic sciences such as chemistry, physics, mathematics, and biology. So, here homeopathy is also having the application of these fundamental sciences. So mathematics is applied in the potentization. The fixed amount of drug substance is considered. Physics is also considered as about the matter, and chemistry with respect to again potentization and how we are diluting the drug substances. And of course biology, that is the science of the living beings. So here Dr. Hahnemann gives importance to the life science. So life science, again there is the functioning of vital energy. So homeopathy is advocating the dynamism, and hence the concept of disease is dynamic and its treatment is by dynamic remedies. Modern medical science gives importance to the material aspect. Now, what is material aspect? Nothing but the disease which is palpable by fingers, say warts, corns, enlargement of liver, presence of the enlarged tonsils. So, for the modern medicine, disease is in this pathology. So, material aspect means whatever is tangible, palpable by fingers or visible pathology. And as I said earlier, homeopathy advocates the dynamism. So, for homeopathy, disease is dynamic derangement of vital force first, and the cause is in this dynamic derangement of vital force which shows effects on the organs. So pathology is the effect or the ultimate of the disease. And where is the disease? Disease is prior to the pathology in the derangement of vital energy by dynamic causes. Modern medicine reduces all the things to the terms of matter and motion. It fails, refuses some great fundamental facts which are not covered by materialistic view. So in theory of chronic disease, Dr. Hahnemann classified the disease not nosologically, not according to the cause of disease. So nosologically means name of the disease. So slightly here I would like to draw your attention to the reference that during 18th century all the scientists were busy in classification. So there was a classification of zoology by scientist Cuvier, whereas Linnaeus was classifying botany. So the medical world, the doctors were busy in naming the diseases and classifying the diseases according to names. They were called as Methodists. So Dr. Hahnemann is classifying diseases not according to the names. And how does he classify? He classifies by symptoms. So this is called as clinical classification of disease. So he classified syphilis and psychosis, two miasms of venereal origin. So for syphilis, great venereal disease at his times, where suppression of primary symptom, that is chancre, caused various constitutional symptoms. So try to understand, for Dr. Hahnemann, syphilis is a primary disease for syphilitic miasm. For psychosis, gonococci as proximate cause and suppression of gonorrhea caused many symptoms. Example, fig warts disease, condylomata, and he said it is a constitutional disease. So what is the relation of gonorrhea and psychosis? Gonorrhea is a primary disease for psychotic miasm. Once the gonorrhea is treated by the injections or by any other drugs, the gonorrhea, the primary symptom, that is purulent urethral discharge in the males, it is removed. The various symptoms are seen in the patient, which Dr. Hahnemann gives the name as psychotic miasm. Rejected existing classification. So Dr. Hahnemann did not accept the existing classification, searching and collecting the data to arrive at fundamental cause of the diseases. So Dr. Hahnemann did not consider that the disease is just the material part, that is presence of pathology. So he went far ahead and he was very much insisting that the disease is not just a visible pathology, it is the effect of the affection of the life principle. Life principle, nothing but vital energy, vital force. And remember, anything which is energy, power, in dynamic in nature can only be affected by dynamic causes, and also treatment by dynamic remedies, which are the three important aspects in homeopathy. There still remained vast variety of diseases to be classified as non-venereal variety. So Psora and psoric miasm is the non-venereal origin. He started reclassification and searched the fundamental cause. He included vast variety of diseases under one name, that is Psora. So, psychotic miasm and syphilitic miasm has venereal origin. Like the removal of chancre in syphilis led various constitutional symptoms which Dr. Hahnemann labeled as syphilitic miasm. Whereas removal of the gonorrhea, that is the male urethral discharge, shows the purulent discharge or condylomatous warts. Removal of this caused various constitutional symptoms. Dr. Hahnemann named it as psychotic miasm. And other diseases where there was no venereal cause, Dr. Hahnemann included all such diseases under one name, that is Psora. Now second point, that is relation of bacteriology to homeopathy. Dr. Hahnemann was so ahead of his time that his teachings could not be understood as science was slowly advancing. So very interesting facts given by Dr. Stuart Close. Specific living organisms as the cause of infectious diseases such as cholera and other venereal disease was first predicted by Dr. Hahnemann. Homeopathic cures achieved in cholera, typhoid and diphtheria. He stressed the importance of prophylaxis, sanitation and hygiene. Parasitical nature of infectious diseases, syphilis, gonorrhea, leprosy, etc. was confirmed by Dr. Hahnemann. But at his times microscope was not there, so he could not show to the medical world. But he considered that minute living beings are cause of all these infectious diseases. Dr. Hahnemann said chronic diseases other than drug diseases, occupational diseases, diseases due to bad hygiene are caused by three primary infections. They can't be overcome nor extinguished. They have their origin and foundation in constant chronic miasms, whereby their parasitical existence rises and grows. So, Dr. Hahnemann said that there can't be overcome chronic diseases apart from the drug disease, that is artificial chronic diseases caused by administration of the various drugs in the large doses. So chronic diseases other than occupational diseases, other than the bad hygiene, are caused by three primary infections. And these chronic diseases can't be overcome nor extinguished by vital energy, and they have their origin and foundation in constant chronic miasms. So miasms are the word which was prevalent at Hahnemann's time. So whereby their parasitical existence rises and grows. So it is similar to the soil which is favorable for the growth of parasitical existence of the diseases. So this is nothing but the chronic miasms, which is they act like magnet and invite the diseases. So fault is first in this system of that individual which is having this soil as chronic miasm which invites the diseases. Miasm means what? The Parts Dictionary gives the meaning as miasma is an aerial fluid combined with atmospheric air, not dangerous unless the air be loaded with it. So today's time we easily understand what are droplets. So this is the similar thing, that the atmospheric air not dangerous unless the air be loaded with it. So air will contain the fluid, aerial fluid. So it can be compared in today's terminology of droplets. So miasma is an aerial fluid combined with the atmospheric air, and it is not dangerous otherwise, but when it is having the loaded with it means the highly virulent. Dr. Hahnemann said an aerial fluid mixed with atmospheric air. Infectious disease has its own variety, can cause infection according to nature of complaint and predisposition of individual. Very important. So this predisposition is nothing but the individual with his system, with his soil, with his magnet, where he attracts the diseases. So these diseases communicable by contact and contagion. The slightest breath can induce disease. Others will daily breathe poisonous atmosphere without injury. Infection is due to contagious visible living creature. So let's understand this point very clearly, that the slightest breath in some individuals can induce disease and others can daily breathe this poisonous atmosphere without injury. So what is the cause of the disease? Is it only in these the parasites or the microorganisms or the living beings, or the cause is in the individual? So the infection is due to the contagious invisible living creature. So Dr. Hahnemann focuses our attention that the atmosphere is full of various living organisms, living creatures which are invisible, and they can cause the infection, but all individuals are not affected at same time. They can inhale this faulty air very easily without getting affected from the diseases. So let's see further. So the point here is the relation of bacteriology means what? The bacteria are the cause of diseases was confirmed by the Robert Kochs, but it was very late of the 19th century. But Dr. Hahnemann was far ahead with his vision, and as said, the science was slowly progressing, but he could understand the presence of these living creatures in the atmosphere, which is responsible for diseases. And at the same time, he also confirmed that not all individuals are affected. So, let's see further. Psora is the oldest universal pernicious disease for thousands of years. It has disfigured mankind and caused several diseases, 7/8 of all diseases. After many years of historical investigations, he said, universally diffused contagious infection embodied in living parasitical microorganisms which grows and multiplies. He named it as Psora. So try to understand that this is Dr. Stuart Close's view, which he understood what is the concept of Psora given by Dr. Hahnemann. Dr. Robert says Psora is deficiency, and Dr. Kane says Psora is spiritual sickness. And here Dr. Stuart Close has the view that after many years of historical investigation, he said universally diffused contagious infection. So universally means almost it is present in all the individual. It is gone from generation to generations. Highly infectious, it is embodied in living parasitical microorganisms which grows and multiplies. He named it as Psora. He originally found that disease manifested mostly on skin and external parts. This cutaneous manifestation of disease has intense itching and burning, and disease spreads by contact. So he labeled this as considered scabies as the primary infection for Psora. Now let's understand the doctrine of latency. Dr. Hahnemann taught Psora psychosis syphilis may remain latent for long times until the circumstances awakens the disease and develops the germs. So in this statement, Dr. Hahnemann is very clear that these miasms may remain latent for long times, and when the favorable circumstance arises, the disease grows and develops the germs. So the germs may not develop, germs cannot develop unless the underlying system is having the favorable circumstances around. It means that the immune system is weakened, and then it will catch the germs and develop diseases. It was reconfirmed by modern researchers in regards to syphilis, gonorrhea, tuberculosis. So this is nothing but in today's modern terms the incubation period. Metastasis. So it was thought ridiculous that each known before Dr. Hahnemann was due to minute visible parasite. Psora has become the most infectious, most generous of all the chronic miasms. Now, miasms also terms present at Dr. Hahnemann's time. We can Consider this term in today's language of infection. The disease by metastasis from skin caused by external palliative treatment attacks the organs and causes multitude of chronic diseases, and cause is unrecognized. So, Psora is the most infectious. Dr. Hahnemann considered scabies as the primary disease for Psora, and the medical field individuals were very much thinking that consider that the disease is caused due to some minute visible parasites is ridiculous. But Dr. Hahnemann, far ahead of his scientific thinking, was considering that there are some minute invisible creatures which are responsible for diseases. So Psora has become the most infectious as he considered scabies as the primary disease and most generous of all the chronic miasms. So the scabies also spreads by contact, has got intense itching and burning. So he considered that Psora has become the most infectious. The disease is by metastasis from skin caused by external palliative treatment. So these scabies eruptions removed by the skin ointments, and then the palliative treatment attacks the organs and causes multitude of chronic diseases, and cause is unrecognized. So removal of these eruptions leads to multitude of the chronic diseases, but the physicians are ignorant and they cannot correlate this. The danger of metastasis. Metastasis means disease travels from one location to other, which we understand as suppression. The danger of metastasis of chronic external skin disease leads to dire results, means very dangerous results. It is a transfer of disease from one part to another. Embolism is impaction in some part of the vascular system of any undissolved material brought by blood, lymphatics, example tumor cells, bacteria, protozoa. So we easily understand embolism is also responsible for the diseases. So what it is? It is the travel of the any tumor cell or bacteria or protozoa through blood or lymphatics. The infectious parasitic microorganisms of Psora driven from skin by local treatment goes to the deeper tissues, structures and organs through capillary, lymphatics or glandular system. Here it develops into specific form according to location, predisposition and environment. So which disease will develop into any individual cannot be predicted. It will be different because every individual has different predisposition. Predisposition means the tendency, the inheritance or the genetic transmission of the tendency to form diseases. That will be different. Each individual's environment, his habits, his housing will be different. The identity of Psora and tuberculosis. So, asthma, pus in chest, pleurisy, bronchitis are due to Psora. This was said by Dr. Hahnemann. All the diseases known due to tubercular bacillus are attributed to Psora by Dr. Hahnemann, and cause is identical. Two terms Psora and tuberculosis are synonymous. Modern bacteriology says bacilli of leprosy resembles tubercular bacilla in the form of size, and lepers react to the tuberculin test also. So this is the modern bacteriology. He has done this conclusion. Dr. H.C. Allen considered polio of tubercular origin. Action of TB bacillus must have favorable condition and suitable soil. So again remember, the most important is the suitable soil. So even if the environment, there are many tubercular bacilli, but if the suitable soil is not there, means if the individuals having strong immunity, he will not get affected by tuberculous bacilli. Only if the individual's immunity is weak or the soil is favorable for getting attacked by tubercular bacilli, he will suffer. So, in the previous concept of relation of bacteriology and homeopathy, also the importance is that homeopathy gives importance to the soil. Soil means what? The system of the individual. So, homeopathy treats this soil, homeopathy treats this system, and this is nothing but the vital energy of the person. And whereas modern medication directs its attention to the treatment of these organisms. So very basic difference between modern medicine and homeopathy. Homeopathy treats the underlying soil. Homeopathy treats this system, which is nothing but deranged vital energy. And modern medicine treats these bacteria, treats these parasites. Also consider heredity, predisposition, environment, food, clothing, light, air, housing, occupation, mental and physical condition, and habits of life. So homeopathy gives very lot of importance to all these factors. So all these factors are responsible for the every individual, and all these factors are different for different individuals. Hence, they will always give different symptoms. As individual causes of every disease vary in their causes and condition, consequently, so in the symptoms or effects. So even if the tuberculosis patient is there, one tuberculosis patient will give history of cough, history of hemoptysis. Another may give the fever or evening rise. Third individual patient may give the pleural effusion. Fourth individual may give the other symptoms or group of these symptoms. Because why this is the case? Because all these factors are like which factors? The hereditary, predisposition, patient's environment, his food, his clothing, his environment, sanitation, hygiene, his occupation, his mental physical condition, his habits are different. Hence, as individual causes of every disease vary in their causes and condition, consequently so in the symptoms or effects. Hence, the symptoms will be different, the causes will also be various types. There can be no specific general remedy for a disease, and this is the reason that there cannot be the same remedy for the disease, as there are different factors affecting the individual, they give different symptoms. There cannot be one remedy for the disease. Microorganisms are one of the many causes of disease. Very important. Microorganisms are one of the many causes of disease. The curative remedy for the concrete resulting disease must have combined effects of various causes manifest as many signs and symptoms. So homeopathy accepts that microorganisms are the cause of disease, but they are not the only cause. They are the one of the many causes of diseases, and the disease must have be having the various symptoms, different types in different patients. Thus, the curative remedy for all these various individuals will be different, and it should have the effects of various causes. So, for example, the bryonia remedy, it will have the weather which will be hot days and cold nights. Dulcamara will act when it is a wet damp weather. Natrum sulph will act when there is a wet weather. Merc sol will have its effect when there is a slight change in the temperature, slight change in the environment. Thus, the remedies will be different and will have different causes. Homeopathic treatment is directed on a principle, that is law, combined with rational, moral, hygienic, sanitary, sociological measures. So, sociological measures means the patient's environment in the family, in the society, work area. Sanitary and hygiene, which is very important for the maintenance of health. And his moral characters, that is the mental symptoms of the patient, very important. So, this combines the individual, and there is a similar remedy found in the homeopathic materia medica. So application of this remedy under the principle of similia is the homeopathic treatment. Now let's see what is toxicological theory of diseases. Life is a state of existence, continuous adjustment of internal and external relations. So patient's internal functions and external environment are continuously changing, and life is a state of adjustment to all these factors. When a pathogen enters the living organism, resistance is encountered, reaction is excited. Disease is a morbid, dynamic disturbance of vital force or power which animates the living organisms caused by external morbific agent. So all of us know that what is the definition of disease? It is first dynamic disturbance of vital force or power which is animating this living organism caused by external morbific agent. So the disturbance of vital force is due to the external morbific agent. All pathogenic microorganisms produce their effects in the living organism by means of their poisons they secrete. So they secrete the toxins. Diseases due to mechanical injury, liberation of chemicals and toxins with circulatory stasis. So the first important cause of diseases is the mechanical cause. But this also causes the liberation of chemicals and toxins with circulatory stasis, and patient comes with the bruise, hematoma. Diseases due to chemical agents like corrosive poisons cause poisoning of the organism. So the second cause of the disease is chemical. And mental trauma causes long continued mental emotion. The chemical neurotransmitters are liberated. So the third cause is the mental trauma. Mental trauma, is it material cause? No, it is the dynamic cause. So diseases are caused by mechanical cause first, second is chemical cause, and third is dynamic cause. But in all the three causes, there is liberation of chemicals or the neurotransmitters. So that was about the toxicological theory of disease. Homeopathy is based on laws of mutual action and reaction, resulting in physiological and chemical assimilation. All diseases are some form of the poisonings. All treatment is some kind of antidote. So, cure is by agents which have power to antidote the poisons and remove the effect. So, cure is possible by agents. So, it is having two roles. The medicinal agent should antidote the poison and also it should remove the effects of poison. Now, let's see further how the homeopathic remedies are acting. The agent must neutralize the poison and its effects as well. So antidotes are three types: physiological, chemical and mechanical. What is a physiological antidote? So they are the poisons of varying degrees of power. So is a toxic substance, and by virtue of its dynamic affinity for another toxic substance has power to neutralize the substance and its effects, which results into cure. So in short, in simple words, that the drug substance should produce the similar toxins in the healthy individual, and this will form certain signs and symptoms. When these signs and symptoms are observed in the patient, this drug substance will act as remedy and bring the cure by neutralizing the symptoms in the patient. Antidote is pathogenically similar to the poison but opposite in the direction of action. So, and what is antidote? It should have same pathogenesis and but opposite in the direction of action. Medicines producing similar symptoms are related and mutually antidotal in proportion to the degree of similarity. So medicines which produce similar symptoms are related and mutually antidotal in proportion to the degree of similarity. So these medicines are homeopathic medicines, which are also called as dynamic antidote. And what is their role? They produce similar symptoms as of the natural disease, and they are antidotal in proportion to the degree of similarity. So higher the similarity, the very fast they will remove the effects of the disease symptoms in the patient. Chemical antidote acts upon the poisons rather than their effects. Its action on property of uniting chemicals with poisonous substance and altering chemical and physical character. So chemical antidote acts on poisons rather than the effect. So it removes the action of the poison and also the effects. Its action on property of uniting chemicals with poisonous substance and altering chemical and physical character. So this is the chemical antidote which acts on the poison rather than its effects. Mechanical antidote means the physical expulsion of poisonous substances from the body after the dynamic antidote are required to remove the pathogenistic effects of the poison. So it's a long sentence, just in the simple words. What is a mechanical antidote? It removes the mechanical action or mechanical trauma on the patient. So the mechanical trauma is the by the like arterial damage causing hemorrhage, or it can be a fracture. So this is a mechanical trauma and it is required to remove the pathogenic effects of the poison. So pathogenic effects of the poison removed by dynamic antidote. So I am very clear that suppose the trauma is there and it causes the fracture. So fracture is treated by the mechanical intervention, and the effects of fracture like the healing of the bones can be done by the dynamic antidote. Mechanical dilution and potentization of poisonous substances causes them to be deprived of lethal qualities and transformed into healing remedies. So, mechanical dilution and potentization is done in the homeopathic remedies. So, poisonous substances means what? Nothing but our medicines. So, the dilution and potentization removes their lethal effect. Lethal is nothing but the poisonous effects and transforms into healing remedies. Pharmacotherapeutics finally resolves into process of physiological or dynamical antidoting based on the law of attraction. So pharmacotherapeutics is it resolves into process of physiological or dynamical antidote. Pharmacotherapeutics here we can correlate with the potentization, and after the medicine undergoes the process of potentization, it becomes therapeutically active and it is deprived of its the poisonous characters and it becomes in the dynamic form, that is the crude drug substance no longer present. So pharmacotherapeutics resolves into process of physiological or dynamical antidoting based on the law of attraction. Idiosyncrasy and drug disease, that is the last point, that is the last concept in this chapter. So natural drug diseases acts conditionally, medicines act unconditionally. Every true medicine acts all the times, in all the persons, under all the conditions, producing signs and symptoms. So that is a well-known fact that medicines act all the times, in all the persons and all the conditions, producing signs and symptoms. The violence, the extent, duration of the effects will be proportionate to the size of the dose and susceptibility of the individual, as influenced by constitution and environment, but it always acts. So medicines act all the times on all the individuals. So the violence, the extent and duration of the effects will be proportionate to the size of the dose. So if we prove the or give the medicine in a high potency, it will have the similar effects and can be correlated with the high potency. So will produce more symptoms on the mind, but it will vary with the provers, as susceptibility is different in every prover, as it is influenced by constitution and environment, but the medicines will always act. It is the peculiarity of the constitution inherited or acquired which makes the individual morbidly susceptible to some agent or influence which would not so affect others. So it is the peculiarity of the constitution inherited or acquired. So constitution is nothing but mental and physical makeup of the person, and there are endogenous. Endogenous means the inherited factors, or exogenous, that is environmental or acquired factors which makes the individual morbidly susceptible to some agent or influence which would not so affect others. It is the peculiarity of the individual susceptibility which makes the individual morbidly susceptible to some agent or influence. It is the peculiarity of the individual susceptibility which makes the individual morbidly susceptible to some agent or influence. So it is the individual soil, individual system which makes the individual morbidly affected by some agent. To the average physician, idiosyncrasy means oversensitiveness to drugs, example quinine, or to fruits such as apples, peach or fish, onions, odors of cat, perspiring horse, etc. So sensitive to all such odors. The patient may come with asthma or hay fever. The fundamental cause of every idiosyncrasy is morphological imbalance, that is, an organic state in which, through excess and defect in the development, excess and defect in function with a corresponding degree of hyperexcitability. So this is a morphological imbalance. It is during the development of the individual. So there can be a defect or there can be an excess in some factor, and this causes hyperexcitability. Idiosyncrasy helps in individualization and differentiation of two remedies. Idiosyncrasy is of two types, inherited and acquired. Drug idiosyncrasy is due to the abuse of drugs. Inherited is the morbid susceptibility to drugs are traceable to the abuse of drugs by parents. So it is said that in 18th century most of the population in the Europe suffering from skin diseases, and they had used all the ointments containing tremendous amount of sulfur. So the drug is abused, and this is the reason that the polycrest property of sulfur to the vast number of symptoms and correspondence is due to the wide abuse of sulfur. Dr. Oliver Wendell Holmes said that if all the drugs were dumped into the sea, it would be better for mankind and worse for fishes. This statement very important, and it highlights how dangerous are the effects of the drugs. Drug disease is so many antispasmodics, emetics, tonics, alternatives, pyretics, acids, septics, helminths, counter-irritants are taken by the patient. It traces the history back to the use of drug. High potency of the drug is sometimes the best antidote for the effects of crude drug. Homeopathy, its too frequent repetition is damaging and adds more confusion. So the high potency is the best antidote for the effects of crude drug. So if the drug in the crude state is giving some side effects, can be removed when the same drug is given in the high potency. Homeopathy, its too frequent repetition is damaging and adds more confusion. So what happens if you are giving too frequent repetition? The second dose may act antidotal to the previous. As why? Because try to understand that it is producing similar symptoms. So if the first dose is able to remove the few symptoms, and if you are repeating the second dose, it will remove the action of the first dose, and thus it can be damaging and can prevent the cure. Thank you. So this was a very vast chapter, general pathology of homeopathy. I tried to make it very short, but the most important message in this general pathology of homeopathy chapter is that homeopathy is the treating the underlying susceptibility, underlying soil, underlying the miasm, whereas modern medicine directs its treatment towards the organisms, the parasites. And the most important, homeopathy is acting under the law of similars, whereas there is no fixed law in the modern medicine. And the most important point is that homeopathy has the basis of dynamicity. So we consider that the vital energy animates the body. So body is the material form, and the vital energy imparts life into the body. So diseases are due to the derangement of this vital energy, and homeopathic remedies are given to correct this deranged vital energy. So automatically it boosts the immune system of the individual. So homeopathy is a natural science, and it brings about cure naturally. Thank you.